Mississippi is the 10th safest prison system in the country when it comes to COVID-19 infections. That's according to data from the Marshall Project. 12 News' Jay Belexis sat down exclusively with the Mississippi Department of Corrections Commissioner Burl Cain with a breakdown on the numbers.
Tell me a little bit about where Mississippi ranks as far as the number of COVID cases in the prisons.
We're at the very top, almost with the least amount. So we're leading the country just about. Top 10% with the least amount of COVID, the least COVID deaths. So we're in really good shape with COVID.
And how were you guys able to do that? And what number of cases are you at right now?
Well, right now, the better thing is we've only had 22 deaths. And you go to Alabama, and they had it in the 70s. Georgia had it in the 80s, and Louisiana's in the 30s. So we're better than all of those. And then the number of cases we've had 1,378 cases, and that's good too. But the real reason was we went to instead of spending so much money on testing, because you test, then you know that moment you don't have it, but you don't know the next moment, the next day. So we spent our money on prevention, and we have some very unique ways we prevented it, and that was with the electrostatic sprayers, and we contracted to buy the sprayers and train the inmates to do the spraying, so we could spray almost continually. And you spray in the kitchens and in the common areas, and so therefore then you control it there, and you're continually disinfecting with those electrostatic sprayers. We also have the ultraviolet sprayers, or it's not really a sprayer, it's ultraviolet light, but it will, for instance, the hospital room or the examination room, you can put it in there at the end of the day, and by the next day the room's sterile again.
And where are you guys at with the vaccine, vaccinating staff, vaccinating inmates, and have you gotten a vaccine?
I have. And so I did get the vaccine, but I got the vaccine because I was in the first category with age. The agreement we worked out with the Department of Health is that we have a new medical provider now, and so we have nurses and people who can give the shots. When the vaccine is available, they're going to give us the vaccine to use for the staff first, and then next, and I think some of them are already getting the shots, I'm sure they have, but next would be for the inmates. And so we need to get them the vaccines as quickly as possible.
Is there any timeline for that? The
medical people are receiving the vaccine, but our employees need to get the vaccine as well as the inmates. So we hope, like everybody else, it'll be as quickly as possible. We hope it'll be in the next month, in February, but we just have to wait like others.
Well, visitation has been suspended to prevent visitors from infecting inmates per CDC and MSDH guidelines. But Commissioner Cain says that they hope to have video visiting in the spring. For more 12 News investigative stories, go to our website at WJTV.com.